Welcome to the Whole Pack, where we challenge black and white thinking in holistic pet care and dive into the controversial topics everyone's thinking about but nobody's saying out loud. I'm Sunny Gandera.
And I'm Melissa Sherman, and we are two holistic pet health practitioners here to prove that holistic care can include critical thinking, self-care, and yes, even Western medicine when needed. This is a judgment-free community we wish we'd had when we started our journey.
Today is a very special episode, not just because it's our first double-digit episode, episode 10, but because we have invited our very first guest on, the incredible Dr. Michelle Rock. Yes, she rocks. Dr. Michelle's love of animals convinced her that she wanted to be a veterinarian at 3 years old. Her first job as a veterinarian was in Cape May, New Jersey, practicing small animal and avian medicine for 3 years. In 2006, she joined an integrative practice in Westchester County in New York, where she utilized holistic therapies to benefit her patients. She worked as both an associate and relief veterinarian for 6 years before she opened her own practice, Full Circle, in 2014. She has become a valued member of the Hudson Valley community, where we both live. Her passion in medicine lies especially in nutrition and alternative modalities such as nutraceuticals, homeopathy, and herbal medicine for dogs, cats, birds, and pocket pets. She believes that the integration of conventional and holistic medicine offers her clients more treatment options for their beloved furry family members. Dr. Michelle Rock's favorite part of her job is communicating with her clients. She feels that the best care can only be achieved with open communication, education, and compassion. So I want to tell you something about this episode before we get into it, because today's guest isn't just someone I admire from a distance. She is someone I walk into the same building with. She takes excellent care of my own 2 dogs, and she's someone who has let me sit beside her in the exam room, watch the way she listens to a patient and a pet parent at the same time, and build something together that I genuinely didn't know was possible when I started this work. She's a veterinarian who chose the harder, braver path, and her practice is proof of what happens when you do. Dr. Michelle, welcome to the Whole Pack podcast. We're so thrilled to have you.
Thank you so much for having me. It is such an honor to be here and to share the space with these 2 wonderful women.
Thank you so much.
Dr. Michelle, I am so excited to meet you. I've heard about you through Sunny for such a long time. You've just been, I've been inspired through Sunny, just listening to how supportive you've been to not just her, but Tofu and Oslo. Let's be honest. It's all about them at the end of the day. So I'm really excited to ask you some questions. But first, how did you get into this? Because what was a moment that you knew conventional medicine alone wasn't going to be enough for you?
Interestingly, it wasn't a particular case or anything that got me thinking about holistic medicine or integrative medicine. My first job in the veterinary field was actually at age 15. And I started at the front desk. I was kennel help, and what I was observing is almost every patient in the conventional practice that I was working at left with either steroids or antibiotics. And what I realized even at that age is that we were treating symptoms. We weren't really treating the problem, because those pets would keep coming back, and I would see them back again to see the vet, and they were there for the same issue. So it started to open my eyes to what other options might be out there. And at the same time, I developed a lot of interest in gardening, and I started my own herb garden at home when I was in high school, and that just opened the door.
That's really incredible. It's such a big moment when you realize that treating the symptoms is just kind of like you're on a hamster wheel, and it's not really, there's no forward progression.
Absolutely.
And it's not, it may stop the symptoms and the suffering for the moment, but the fact that there's still something underlying, it takes a special kind of human to really dig into their curiosity and ask questions beyond what we're learning, beyond what you learned in your studies, to actually dig deeper. So I really admire that about you. And other, colleagues in the same field that have looked at conventional medicine, worked in it, but like pushed that and said, there is more. And that's why, hey, that's why you're so inspiring to us, because we kind of think the same way, right?
Exactly.
Like we just want
Very
to
similar
help them
philosophies.
at the
Yes.
root. Yeah.
And I certainly, even before I got into this field, when I was, seeing Dr. Michelle with my own dogs, I remember you giving me, doTERRA essential oils and, homeopathic drops. And, now, of course, immediately when you see me that I'm not going to suggest anything conventional to Sunny unless it's absolutely necessary. But I was curious, like, how does, the sort of holistic lens kind of how does it get brought into everyday practice? Like, say if you're just seeing, regular patients who may not know about it, how do you sort of, include that in your practice in a way that, is beneficial to them, obviously, but also like introducing them to that sort of, aspect of veterinary care?
Well, I think that a huge part of it is just reading your audience. Because, of course, the beauty of having an integrative practice is that there's a time and a place for conventional medicine. So you still need to reach for that at some points. And there are some people that you have to meet them where they're at. You have to understand that they might not be open to some of those things, that other people might be very open to them. So there's a whole spectrum of how to approach things like that. But I usually start by addressing things like vaccine titers, which is a nice doorway. So it's just pulling back on the number of vaccines that we might might have to not have to give if we can prove that they still have protection in their system from a previous vaccine that was given. So that's a nice little introduction. And I mean, to the point of why we're all here today, nutrition is a beautiful doorway because because getting away from, I think it's one of the easiest conversations to have, because people don't have to know or be open to herbal medicine or homeopathy or acupuncture. Talking to them about what they're putting into their dog or cat makes sense to them. So just talking to them about how processed their food might be, and would we eat a processed diet like that 100% of the time? And I think it just speaks to their common sense. And so it's a natural pathway into a more integrative approach.
Yeah, that's definitely something everyone can relate to, food, right?
Yes.
Thinking about yourself, as you said. And so this week was my first week with Full Circle. I was actually in-house, and I got to, see a lot of, meet a lot of new clients. And I actually happened to meet one that you had referred me to, Brooklyn. And speaking about nutrition, the mom was saying, like, I couldn't believe how fast it worked, because this was a very cute, lab or, retriever style dog. And, and he has started losing his hair and, gotten skinny. And he said within 3 to 4 weeks, his hair
Chronic
started going
diarrhea
back.
he had. Yeah.
And diarrhea, things like that. So it's so rewarding. But, none of that could happen without someone like you seeing the potential in fresh food, because a lot of times veterinarians, they will, recommend prescription diets and things like that, which, I don't know how much prescription is in those diets, but that's another podcast.
Yes.
But, speaking of how you're
Episode
also very
11.
different. Yeah. Episode 11, exactly. So, I sought you out because I wanted to go to a privately owned and a small practice, because there is so much happening in the veterinary industry now. So I wanted to ask you, like, of course, this corporate consolidation is really reshaping veterinary medicine, and it's really quick, right? They're buying up everything around you. So we don't get so much insight into that side, as holistic pet health coaches. So we were really curious, like, what does it take, or has it taken, to stay independent, and what does that actually, what does that independence actually protect for your clients and your practice?
Well, ultimately, I mean, my journey led me to, I think I knew pretty early on that I wanted to own my own practice at some point, because a huge part of this integration is just being able to do things the way that you feel connects with people. And I feel like human medicine, I feel like veterinary medicine, it's really become more of a machine. Just how many people can you get in and out? How many, I mean, like, there are so many conventional practices that I did relief work with that were glorified vaccine clinics in a lot of ways. It was just, you know, my first job, my bosses told me there shouldn't be, I said, can we make longer than 15-minute appointments? Because all my appointments were 15 minutes long. And they said to me, well, what can't you do in 15 minutes? And I said, what can I do in 15 minutes?
Right.
That's the more important question. So for me, that communication step is absolutely essential. And I feel like that's something that corporate really could take away or leach out of this profession as a whole. I mean, we've seen it happen in corporate human medicine.
Right.
Doctors are in the room with you for what, 7.5 minutes, 8 minutes? Like,
If you're lucky, yeah.
if you're lucky. But for me, sitting down and often on the floor, as Sunny knows, in the exam
I
room.
love that. Yes, I did. It's just so, I mean, that I wanted to bring that up. It's like when I first came in, it's like you just like plop down on the floor with the dog. And you know, of course, now Tofu's like, all right, buddy, her
She
butt's
sits
back
right in my lap.
pushing.
Yep.
And she's like, okay, I want a butt rub, Dr. Michelle. And, you know, you could just see how comfortable they are with you. And that's really comforting for me because especially if you come in with a dog that's sick or you're really worried, you don't want that cold, like, okay, I'm just like here, but I'm not here. And you can just tell. And that's another thing I really wanted to say to everyone who's listening is like, it's so rare to find a veterinarian who is so, you know, you can see you really truly care. And I mean, I remember, I'm not going to say too much about this, but when I had to bring Nacho in when he died and you were just giving me the longest hug, we just hugged for like 10 minutes. And I could tell that you were just as distraught as I was. And I know how much it takes out of veterinarians to do this work because you have to do euthanasias and you have to do, you know, say goodbye to so many pets and see them in such horrific conditions and then still be connected to that feeling. It's really, really rare. And so I just really want to say how much I appreciate you. And this, obviously you were meant to be a veterinarian. You knew at 3 years old, but like, we are just so blessed to have you. And I just wanted to say thank you for being such an awesome human being.
Thank you.
Yeah.
I love, for me, the most rewarding part is connecting. It's connecting to people. It's connecting to the pets. The best compliment that I've ever gotten on numerous occasions from my clients is that their cats or dogs have been more comfortable and more at ease in my practice than they've ever been in another vet's hospital. And that means the world to me. That means I'm doing something right. And if I was not independently owned, I feel like I wouldn't have the ability to take that time. You know, when I can say every new patient gets 45 minutes to an hour, and I can sit there with new pet parents that have their first puppy ever, and I know that I have the time to talk to them because they're completely overwhelmed and probably sleep deprived, just like new parents always are. And I can take the time to talk to them and answer their questions. And I think that even though there's a lot of information coming at them, people are just overwhelmingly appreciative of the time that they get when they come here.
Yeah, absolutely. No, that's so true. And it's very special. It's very rare these days to have that. So thank you for standing on your island and being, you know, independent because we need more of you guys for sure. And
yeah,
we
it
know
does.
that,
It does
you know,
make finding help hard because certainly I can't compare to what a practice can dangle as the carrot in front of the other vet.
Yeah.
You know,
Yeah.
I can't. The dollar signs don't match up. They don't tend to match up the same way a work to live, not live to work philosophy, holds up. So unfortunately, I feel like if I could get people here, they would stay. But
Yeah.
getting them here is tough with that corporate
Yeah,
world
well,
being
like-
my competition. Yeah.
I can certainly say that you've created an amazing community of people that work here. That it's like family, you know,
Yes.
and you see that, you know, people are just, you know, very happy here. So Yeah, it's like you said, what's more important, the dollar or the quality of, a place where you look forward to going to work.
Exactly.
And that's what you've created for sure. Yeah.
Yeah.
From my perspective, first of all, I want to move there, so you can help me with my animals, because it's very, where I live in a rural community. I do have a great rural veterinarian. He is independent, but he's conventional, so we don't always see eye to eye on things. But I see some of the same struggles that you're describing, where there's not the cash incentive. However, people do really, the right people want to work in something where they feel like they're making a change, they're making a difference. And I really feel like the way that corporations have taken over, it's taken the humanity out of it. It's taken the part of care out of it and made it into a commercial commodity where healthcare for us or our animals should never be that. There should still be this element that you bring to your practice, which is, it's amazing. It's very inspiring. I mean, hopefully even this podcast, you'll hear, somebody will hear it and come looking for work from you, because, the right people will find you, and you'll find the right people, because it's so important to remember, at the end of the day, part of healthcare is being able to be heard and tell what's going on, not just with, the animal, but the human, what we're going through, and hey, how do I do this better as a pet parent? How can I better support them? And it sounds like you're doing that at your practice, which is so incredible. And I'm not joking about moving. Sunny,
Yeah, I would love to.
I'm going to be her taste tester for when she cooks. And
That sounds awesome.
Yeah. So we're going to get into the whole, I think, Melissa, you'll talk to, ask a little bit about the health coaching, aspect and the connection we have. But I wanted to ask, what are some of the challenges you find, in your day-to-day work, in terms of is there something that we can do to help veterinarians? Not saying health coaches, but pet parents, because I know that it's really tricky sometimes. Someone comes in with allergies and they're just never, getting better, or it could be something completely different. But what is it that you feel like, oh, I just wish I could X, Y, Z? Is there something that stands out to you that you wish, would be easier in your practice?
I think the one phrase I wish I didn't ever hear was, I've tried everything.
Yes.
And I know sometimes it can feel like that.
Right.
But I can guarantee we haven't tried everything.
Right. Absolutely.
So just coming in with an open mind, I think, is really, really important. Understanding that there are options you might not even know or be aware of. And I always say, my job is to be a guide. My job is not to be or play God and make decisions for you. I'm here to present options and then understand that you know your pet better than I ever will. So for me, it's listening to the more information that you can give me related to your concerns, the more we can dive into what's the fuel behind those concerns and how to get to the root of that. The beauty of having our relationship, Sunny, is that we can take more time between my time and you. I can start to address some of their concerns that might be able to be addressed nutritionally, and then say, I have the perfect resource for you, and direct them to you, because then that is your sole focus, where it might not be able to be my sole focus because I have to deal with 3 other things that are happening with that pet. So,
Right.
yeah.
Yeah, exactly. And that's, we were talking about that, as much as you want to spend hours with that, each patient and answer 25 questions a day, that's my job. And that's what I feel like. I feel very blessed to be able to do that, but also really, it helps me too, to understand where pet parents are. And I just had 3 questions from one of your clients yesterday as I was sitting in the office emailing, and I'm like, that helps me. It makes me feel good because I know you don't have to deal with that part, because I can deal with that. That's not my that's not necessarily, of course there are things that you can do that I can't and vice versa, right? So like we are very good
Exactly.
at like collaborating in that sense. But anyway,
Complementary, yes.
we won't get ahead of that because I know Melissa has some questions too. So
I do have some questions. So, I mean, that tees us up, right? So this is really for both of you, and I'll start with you, Dr. Michelle, but when you both started working together, what were you hoping? And you kind of hinted at it. What were you hoping it would add to your practice? And what has surprised you about what's actually unfolding? Because, I mean, we started with referrals, but now she's in the office. So it's evolving, which is,
Yes.
as a fellow coach, again, very inspiring. And I'd love
And
to
so
hear
exciting
both
for
of
me.
what you think. Yeah.
Because one of the reasons that I brought this up to Sunny initially and said I would love to have you here in the office is because I would love to lean a little bit more. I'm at a point in my career where I would love to lean a little bit more into the more holistic or more naturalistic approaches to medicine, which do inherently take more time and hopefully get away a little bit from what I call the putting out fires type of medicine. So just the, oh, I have an ear infection, I need an immediate treatment. Oh, I have, I have a little skin rash, or, I'm having diarrhea for the last 24 hours, and it's just like boom, 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 and you need to just, turn over, and they just want that instant gratification. So as time has gone on and I've hit, past 20 years doing this, it's definitely raised more frustration in my personal satisfaction in veterinary medicine to have to do more of that style and less of what I love, which is more of that integration or more of that getting away from the purely conventional approach. And so bringing Sunny in, I said to her, I feel like this is a natural step towards setting our practice up for people seeking us out that want that level of medicine, and not just the people going, hey, my regular vet can't get me in. Can you fit me in? Or, like I went to Petco for the last 3 years and now, can I come to you? You might not be the right client for us, is what we're coming to understand. And it's okay to say that. Like, I felt really guilty about saying that for a long time. But that's what I really see bringing Sunny on as an evolution.
That's awesome. And Sunny, similar question. I mean, what were you hoping it would add to your business, and what surprised you as this is evolving?
yeah, I mean, I think that, as you probably also know, Melissa, that sometimes it's hard for us holistic health coaches because it's a fairly new industry or business inside the industry or niche, if you will. And so you always get met with, well, my vet tells me this and my vet says this, right? And so it was kind of like, it's nice to have Dr. Michelle say, no, I recommend that you do what Sunny's, says in terms of nutrition, or like go to Sunny, and then like, oh, okay, I'll instantly do that then, because I remember one of your clients who's now mine too, and I won't mention her name, obviously, but she was saying like, oh, I'll do whatever Dr. Michelle says. So it's kind of like, it's kind of nice to get that sort of entry in, because once they do start to, once we do start coaching together, they love it and they get results, and that I'm really committed to results. So what I'm surprised about is how, quickly, I've seen these, I've been surprised at how willing these clients are at cooking. Because I was like, they're never going to cook, But then, again, what you were saying, Dr. Michelle, is like, you might not be the right client for me. You have now kind of that practice of like fielding out who may not be your ideal client, because they're never going to be happy. They're never going to be a fit, like you said. And then you are not going to be able to produce results for them. And I see the same thing. We talked about that in last episode. It's really like we need to be able to, say no if we know that this person is just not going to want to be helped. So the surprising part, I guess, is like I have a less of a hard time saying no if I feel like this isn't a fit. But like that doesn't mean that person is wrong, and I'm right, but it's just like I want to be able to find that connection, right? So
Yes.
I've just been very surprised at how how well it's been going with all of the clients I've been referred to by you, Dr. Michelle, and how and they're so nice, and they're so willing to do whatever they need to do for their dog. So it's been super rewarding, and I still kind of pinch myself that this is happening because I wanted to create a closer connection between veterinarians and health coaches and make veterinarians understand that we are here to assist you. We're not here to take away from you. We're here to help and make you look better. Like, I'm here to help you. I'm not here to like put myself up on a pedestal, but, oh, I'm so amazing. That's not why I'm doing this. It's really to make them see, like you were saying earlier, Dr. Michelle, there are always options, right? Yes. Like you have people coming, oh my gosh, she's had allergies for 8 years, nothing works. I've tried everything. Well, then we try something different, and oh wow, his paws are, better now, and so it's really rewarding, and that's why I got into this. It's not for money and fame, obviously, but it's just to help animals. So it's been really a wonderful experience so far, and we have so much more work to do, and we're just getting started.
Absolutely.
And it's the open-mindedness of both of you that can see that, Dr. Michelle, you can flow where you work well, where you can focus your attention on something. And then Sunny can do where she flows well and something she loves, cooking, nutrition. So the two together is at the end of the day going to help the animal the most rather than
Absolutely.
one or the other. Having both, having a team, really having a team of practitioners is what's going to elevate that animal's health. So for other veterinarians that might be interested in working with a coach or working with a nutritionist or working with an animal communicator that's not really, they're kind of on the fence. They're a little hesitant. They've heard a lot of things online about, the bad things about coaches. What would you say to them?
That's a bit of a loaded question, I'm not going to lie. Because getting most conventional vets even to open their mind to something like the word raw diet is difficult. I have a practice that I will not name that is in our area that whenever one of my patients goes there, my joke on my end is as soon as they say that they feed a raw diet, it does not matter why they are there, but the raw diet caused it. It's like the dog's there for a broken nail. Well, it must be the raw diet,
That's funny.
So that's why it's a bit loaded. Because I would not dream of trying to convince a lot of my colleagues that my path is one that they should pursue as well. Not only because it sets me apart, but because I feel like, back to that taking the time with clients, I feel like a lot of vets, because they don't take that time, unfortunately, it then inherently makes them lean in to conventional diets because it's easy, right? It doesn't take any time to reach for an alphabet soup diet off the wall for whatever medical condition you're trying to treat.
Right.
So I guess the very short answer that I've been hedging around is I don't know how to open other people's eye or other colleagues' eyes to a relationship like Sunny and I have, because I feel like they would have to already have that open mind and that desire for that connection or that communication. And although I won't say that my experience is vast, I have done relief work in a lot of practices in this area. And the great thing about that was I could definitely see what I wanted to take away from that or what I wanted to leave, So I don't know if I actually answered your question. I'm sorry.
No, you did. And it's really, I'm jumping from here to here when there's a lot of steps before we can talk to conventional veterinarians Because there has to be an openness and a willingness to see that there's other ways to support the animal rather than what they've been trained in. So like that's step one. And then it seems like an integrative vet or a holistic vet would probably be more realistic for a practitioner that's not a veterinarian to approach somebody because they've
Most
already
definitely.
kind of crossed that threshold of, wait, there are more things that we can do. Oh, there is another way to look at this. And it's about open-mindedness, I think, more than anything. So, I mean, I think what you did is describe the hurdles that a lot of our colleagues are presented with, including myself. You know, I mentioned my rural vet. I love him. He's great. He listens to things I say about, you know, I'm not jumping to just, I'm not slapping antibiotics on this just because we're here. I'll take him home with me. But like, and he'll listen, he'll respect me. He'll respect me about vaccines. But that's because he's independent. So I already have crossed one hurdle. But yeah, when I talk about that I feed my dogs a raw diet, I get that same thing. Well, that's probably why he's like, so I completely understand what you're saying. So
And unfortunately,
yeah.
that problem, that the foundation for that issue is laid down way before, because I was the heretic in vet school because I wanted to pursue a raw diet, or because I was open to things beyond conventional, you know, commercial diets. It's forgive the harsh term, but I called it brainwashing when we were in vet school, because it was like, okay, if a big conglomerate food company is going to buy you lunch when you're a starving vet student, and they're going to put a new radiology wing on your vet hospital, then of course, that's the food you're going to learn about. You don't sit down and have a nutrition class that talks about home cooking, that talks about raw diets, that talks about, you know, true nutrition, whole food nutrition. You have a nutrition class that talks about K-calories and talks about AFCO complete and balanced diets. And I mean, this is what vet students learn, unfortunately.
Yeah.
So it's like you automatically have to not want to walk that path the way it's laid out for you to come to the place where we are today.
Yeah, so true. I mean, we obviously have had a lot of discussions around that too, and it's you know, I think it's important to talk about it. Obviously, you can't like slam your colleagues or do anything like that, because I mean, it's like we can talk about the industry as a whole in terms of, you know, this is the reality, and pet parents should know, at least be aware of it, and they can make their own decisions. I mean, we all have different lives and lifestyles. So like, if you want to do kibble, I'm not going to shame them, but you know, the thing is, there are definitely, you know, a lot of those things going on in terms of, like you said, brainwashing, which I totally agree with, you know. But, you know, I wanted to go back to like our relationship too. And like, if health coaches are listening, I think what's really important too is like to take the time to build the trust, right? I mean, I was fortunate that you are actually my vet for my own animals, but, you know, I did really like, you know, I wanted to make it easy for you to sort of include me. So you can't be like asking a vet who's like working their ass off and just be like, hey, can you just like do this and that? Like, you have to come with suggestions. Like,
Yeah.
As a pet parent, I would have loved to have this, because I'm actually in that position, right? I can actually
Yes.
tell you like what I would like to see as your client too. So I can add that. And I came with several proposals that I think would be helpful for
And things
you.
I never would have
not
thought
for
of
me.
even. So
Right. So that's like, you have to take the initiative, and, you know, whereas maybe a door does look closed, maybe you can start to learn that person, get to know them, and find out what are your pain points, what are your challenges, how can I make your life easier, versus what can you do for me? Because like, they don't need you. Nobody needs, you know, like, I mean, you're busy, you don't need no more clients, but maybe you want to, you know, heighten that experience for each client, right? So they can feel really like, oh my gosh. I mean, I think everyone that comes in loves you anyway, so you didn't need meat for that. But I'm just saying that, you know, I just feel like it's a two-way street. And so, but yeah, the openness, obviously, there has to be a little bit of an open door before you start the conversation. But it is, like I
Right.
said, it's a new thing, still very new. And that's why I'm just so ecstatic about our relationship, and I couldn't
too.
say enough good things. I mean, we'd have to put a podcast up that lasts for 5 or 6 hours at least, but you know.
I commend you both for just stepping out of the norm and what, box we've all been shoved in, and really paving your own path and setting a really great example for all of our colleagues as to what the future can look like. I mean, this is, as coaches, I think we kind of dreamed of this future, but to actually see it, Sunny, oh my gosh. I mean, she's like, we all want to talk to Sunny. Like, but like it has a lot to do with you, Dr. Michelle, as well. So
Yeah.
like, I thank you for saying yes to this partnership and just setting a great example as to what the future could be. I have goosebumps. I just
Yeah.
love this.
Yeah, it fills me with an optimism that I think a lot of times as we get further and further into our career, we can get bogged down with a lot of cynicism.
Yeah.
And this is one of the first real islands of optimism that I have had in, like I said, the evolution of my practice. And I feel amazing to be a part of it, and that Sunny felt like we had a safe enough space to start this. And yeah, I'm so excited.
I mean, very exciting, and what you're building here at Full Circle, it's really proof that you don't have to choose between that rigorous medicine and radical care. I mean, the two can live in the same room and actually make each other stronger. And I just
Absolutely.
want to thank you for being the kind of practitioner who makes it possible to do the work I do alongside you. And I'm just thankful that you are open-minded and that we are listening to each other, and it makes everything possible. So thank you so much. And I don't know if you wanted to say anything else, maybe Melissa, before we.
No,
Sign
I
out.
mean, Dr. Michelle, how can people find you if there
Yes.
are people in your area that are just so inspired and they need a new veterinarian? How, like, website, or where can they find you?
Yep. So we are at fullcirclevethospital.com is our website. So we figured enough people didn't have to try to struggle to spell veterinary, so we just shortened it to vet. Full Circle Vet Hospital. And our phone number here is 845-234-4417. And just for you, Melissa, or for anyone else that might be listening, if you already have a conventional vet, I do also offer phone consultations for the supplemental or the nutraceutical portion. Obviously, for people out of state, I can't prescribe anything without having an in-person relationship, but I can make supplement recommendations, and I can see what you've already done and just maybe make some suggestions. So that is also an alternative. I have clients from California, clients from Pennsylvania, that have been with me for probably 15 to 20 years, just because wherever I go, they just find me there and they call, and that's how we connect over what supplements works for their pets as well. So
That's really exciting. I'm really excited. I didn't know you did phone consults, so I think myself included and a lot of people will be very pleased to hear that. So wrapping up this episode, it was amazing. You're our first guest, so thank you for doing that.
Thank you for
Sunny,
having me.
Yeah, congratulations, both of you, on this collaboration, because again, I won't go into it again. I'm inspired by both of you, so thank you. And for our listeners, make sure that you follow the whole pack at all the socials. And if you have any thoughts or you have any questions about this episode, please feel free to reach out to us, whether you comment or reach out to us on our socials. And if you can, give us a rating and review. We really appreciate it. Thank you all so very much.
Thank you, guys.
you.
Thanks, Dr. Michelle.
Thank you, guys.
Bye. Before we go, we want to remind you that the information shared on the whole pack is for educational purposes only and is not intended to replace veterinary medical advice, diagnosis, or treatment. Always consult with your veterinarian before making any changes to your pet's diet, supplements, or healthcare routine. Every animal is unique, and what works for one may not be appropriate for another. We're here to empower you with knowledge, but your vet is your partner in your pet's individual care.